Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey there, everyone. I'm Dr. Burton, the host and creator of the Dr. Mama Says podcast. As always, I really want to thank you for tuning in, because every time someone tells me that they learned something or appreciated something that I've shared, it empowers me to keep on creating. So here I am. Today's topic will be a discussion about our sinus cavities. I think everyone has heard about facial sinus cavities and that a sinus infection can happen, but we usually just call them sinuses. But I was trying to say sinus cavities so that, we can kind of be all on the same page. For instance, the normal heartbeat is called the normal sinus rhythm because there's an important sinus in the heart. There are also several types of sinuses in the brain. In fact, I went ahead and Googled sinus and found there are sinuses all over the body. Why did I Google it? Because I did. And I found out that there's a bladder sinus. What? I thought ENT docs had dibs on sinuses, but I guess not. At any rate, most people say sinuses when they mean the sinuses in our face. And because I'm an ENT doctor, that's the sinus I'm going to talk about. The fancier name for sinuses is called paranasal sinuses because they're located around the nose. Anyway, to better understand how to treat problems that happen in the sinus, it's kind of important to learn some basics. Who has them? Where are they located? What do they do? So let's just jump in first of all and say, what are facial sinus cavities? Our skull bone is actually made of several different bones, and some of these bones are very, very thick because they protect our delicate brain and eyeballs. Sinus cavities are hollow, air-filled areas in some of the skull and facial bones. They're lined by soft pink tissue called mucosa, and of course, they make the mucus. Now might be a good time for you to head on over to my blog and check out a post that I wrote a few months ago, in fact, might have been last year, about mucus. It tells you all the fabulous things that mucus does for our body, how it keeps us healthy. And each time you think about those nasty boogers that you're blowing out of your nose this season, remember, the mucus is your friend. There are actually 4 different sets of sinus cavities, but they're all connected to each other by common drainage pathways. Each sinus can vary in size based upon where in the face they're located, as well as how old the person is. Some of the sinuses are just one big sinus cavity, and others have lots of little dividing bones, so there's actually a group of smaller sinuses. The sinuses actually enter the facial bones through little drainage sites inside the nose. I previously wrote a blog post giving lots and lots of details. In fact, maybe more details than you ever needed to know, but the nose has a lot of different functions. So just take it from me that there's a little opening in the nose that goes to the sinuses. A lot of times when people say, I think I have a sinus infection, or they press on their sinuses and say my sinuses are congested, actually knowing where the pressure and pain is important because different sinuses are associated with different problems. The main 4 sinuses are, number 1, the maxillary sinus. That's the sinus, the big sinus that's located behind the cheekbones. That's the one most people think about when they talk about sinuses. The ethmoid sinuses are actually a little cluster, like a group of grapes, that are located between the nose and the eyeball. The frontal sinus, it's located on the lower part of the forehead, just above the nose. And the sphenoid sinus, that's located all the way in the back, almost in the middle of the head. So typically, we all have 8 sinuses, but of course, just like with anything else, we may develop differently. Some people are missing a sinus or 2. Some people grew some extra sinuses. Air cells grew into other facial bones. But most of the time, the 8 sinuses that we're concerned about are the ones I just talked about. One of the biggest questions that always comes up is, why do we have sinuses? And of course, once I started my residency, my stock answer to that was, so ENT doctors can have a job. I know, I'm a comedian. But the short answer is, no one actually knows. There's lots and lots of theories, and I kind of like all of them. One theory is they help to humidify and filter the air that we breathe. When the nose and the sinuses are filtering and humidifying air, it's important for everybody. But I especially discuss this with my patients with asthma because if they're stuffy and they can't breathe well, they open their mouth and you're missing that important humidity and filtering. So you're taking dry, dirty air already into lungs that are kind of twitchy. So the nose and sinus has an important job to help to improve the air quality that goes down into our lungs. The sinuses are also thought to improve the quality of our voices. You know when you get a cold and we say, oh, my nose sounds nasal? Yeah, that's because our voices aren't allowed to resonate and be enhanced by the air-filled cavities. Sometimes parents get so used to their kids having a muffled voice that they can't even tell that it's stuffy. When I ask parents if their kids have a change in their voice with their nasal congestion, sometimes parents don't know. So one of the tests that I do is I say, okay, have your child say Mickey Mouse. And of course, the child says, Mickey Mouse. Then I say, pinch your nose and say it again. Mickey Mouse. Yeah, they're not supposed to sound the same. A lot of my patients, Mickey Mouse sounds the same whether they plug their nose or not. Just a little tip for you to see how stuffy your nose is. Another thing sinus cavities are thought to do is to enhance our sense of smell. I don't know why they do. I guess extra surface area. But my favorite theory is that they simply make our head lighter. Imagine having a big solid piece of bone, like a bowling ball, sitting on your shoulders. It's hard to lift your head up. I personally think that's funny and one of my favorite answers. As an aside, not really on topic here, but you know how I Googled to learn a little bit about this topic before I started talking, wanted to bring in fresh information. I actually Googled sinuses in animals. Why? I don't know, but I did. And animals like cows and horses have sinuses. But what I didn't know is that it almost sounds like there's an ENT specialist for pets. They get CT scans of dogs for sinus infections. They put telescopes into the nose. I even found a section for tonsillitis that's more common in dogs and rare in cats. Who knew? Dr. Google has some really interesting things. Anyway, when do sinus cavities develop? This is a really important take-home message. If you're listening to me today, you're going to be in a small percentage of people in the world who know this right answer. Every week, at least once a week, someone tells me that babies don't have sinuses yet. Nope, that is not correct. Well, to be fair, the statement is partially correct because all the sinus cavities don't develop at the same time. The maxillary, the one in the cheeks, and the ethmoids between the eyes, they actually develop during the 3rd or 4th month of pregnancy. That's right. Infants are born with sinus cavities. Ding, ding, ding. And those sinuses can get infected. Sinus infections in infants, like so many other infections in infants, can be a true emergency because the bone between the nose, eye, and brain is very thin. Infections from the sinuses can readily pass into other locations. So keep flushing that mucus out of that baby's nose. The sphenoid sinus, that's the one that's in the center of the head, it develops from the back of the ethmoid and starts to develop around age 4. The last sinus to develop is the frontal sinus. That starts to form around age 6 or 7, but isn't fully developed until the mid-teen years. So yes, infants have sinuses. They can have a sinus infection. So please don't ever say babies don't have sinuses yet. So these sinus cavities are present, so what kinds of things can happen in them? Well, obviously the biggie's infection. When the nose becomes inflamed and swollen due to a common cold, allergy, some other inflammatory process, the sinus drainage pathways can become swollen and blocked, mucus gets trapped in the sinus, and an infection occurs. An entire discussion just on sinus infections can happen. But as a brief overview, let's just say there are 3 basic types of sinus infections. The first one is an acute sinus infection. That's short term. It's something that gives symptoms that are less than 3 months long. And they get better when you give the appropriate treatment. The second type is chronic sinus infections. That's long term. That, of course, means you had symptoms that are longer than 3 months. And then recurrent, that you do get that acute infection, it goes away. But then it comes back repeatedly. What's the definition of repeated? 3 or more times in a single year. Now, besides the expected viral and bacterial sinus infections, there can also be fungal infections. You can have nasal polyps in the sinuses and tumors, Both benign and malignant tumors can happen in the sinuses, and they often need to be evaluated. So that's it for today. Very short and sweet, just introducing the sinuses. I'm going to have separate podcast episodes that are going to talk about how do you diagnose sinus infections? How do you treat sinus infections? And what are some of the complications of sinus infections? Again, trying to keep little bite-sized chunks of information so you can digest it, have a take-home message, and then move on from there. So that's it for now. I gotta go. Thanks so much. Hope you come back and listen again soon.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to iTunes and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in this episode, a summary of the show can be found on www.drmamasays.com. And don't forget to subscribe. Hope you come back and listen again soon.